Thank you, Chairman Gozar, for the opportunity to join this hearing, and thank you to all the witnesses, especially the elected representatives of their nations. I'd like to begin with my first question to Chairman Jose. Chairman, what sort of programs and services does the Tana Atam Nation currently have to help your community deal with the addiction to illicit substances like fentanyl? What is available? And I'm referring to things like treatment centers, outpatient centers, and those types of services.
Well, Chairman, members of the committee, thank you for the question. We have a Tonotum department, health department, and in that department, we have a behavioral health program. It's very limited in terms of maybe a clinical director and some staff in terms of counselors. And so we do not have a treatment center. We would like a treatment center. And so basically, it's just some counseling. Most of the stuff is referred out to one of the local, Tucson or Phoenix or other areas where they're able to provide more adequate substance abuse training or go into a treatment center, because we do not have any. So it's very limited. We're hoping to build a more robust behavioral health program so we can offer those things. Most of the time it's either culturally related or just peer counseling to try to address the needs of our members. Thank you for the question.
Thank you for that. And there isn't a treatment center. Are there other obstacles that you currently are facing that prevent members of the nation from accessing these services?
Chairman of the committee, members of the committee, thank you for the question. Yes, in a perfect world, if we had all those things that we could, like a treatment center and so forth, you got to look at the overall picture. Even currently in just domestic services, our roads, we can't go down our roads. Our roads are deteriorating. Transportation, we got 2.8 million acres of land there. It takes about 2 hours to drive from one end to the other, north or south, east or west. So we're limited on transportation. We're limited on housing. There's a lot of impacts that face our members there. And so as we're attempting to address those issues, it isn't just one thing that is needed. So we're faced with various challenges to address the behavioral health needs of the Tohono O'odham Nation.
So, Chairman, it's a vast area of land populated with 36,000 people. If you could, once again, because I think you did it in your testimony, emphasize what federal government support to the tribe in responding to the various treatment needs in the community. What would that be?
Thank you for the question. And it will echo as well as some of the other tribal leaders here, is that I believe there needs to be more direct funding with tribes. You know, sometimes we get caught up in the bureaucracies, the red tape of funding, and if there's federal funding available, it's usually, okay, here's a grant opportunity, you got 30 days to apply for it, and you got to get back, and then the tribal processes are a little bit difficult. So, number one, I believe true consultation with tribes to address those needs, because who's better to address the needs than the people themselves? And so when we have that consultation and we have that direct funding, we're able to really put the money where it works, because you can build something, but if it's not designed to address the local community, I mean, I wouldn't come in and rearrange your house for you. I would work with you, or I would have you rearrange your house yourself or build your house yourself. So what we need, what tribes need, again, is true consultation, direct funding to cut out all the red tape and the limitations that we have with the federal challenges that we have in expenditures and so forth. We're not asking for full reign. Tribes are accountable, and so we want to work together with the government.
And in 5 seconds I have, Chairman, does the nation have the capacity to deliver those services if funded directly?
Yes, sir. We do.
Thank you. Mr. Chairman, I yield back.